Suppose it goes transparent and patients are aware about who is taking commission and who is not taking commission. So what according to you he thinks of, or he will go to a doctor who is taking commission or a doctor who is not taking commission? Where will the patient and caregivers go?
The patient's interest is to seek help. He will go to the person, he will go to the doctor where he is properly listened and where his problem is solved.
But given a condition where
Uh,
this is not so clear, because a patient doesn't know what is the difference between the two doctors of the same degree and even from the same institute with the same of experience. So when he has to choose, so given a condition that he knows that some doctor is uh, taking referral money or another doctor is not taking referral money, what according to you his trust will be more? Which doctor he will choose?
See, in today's scenario, the patient doctor relationship is gravely eroded.
True, sir.
That trust when they used to think, the patient used to think a doctor to be next to God.
True.
uh, that situation is not there now.
Okay.
Now patient is the consumer and the doctor is the service provider, like any other services.
Okay.
So he is not doing anything noble to the patient.
True.
When uh, when it's a noble work, in that case the patient cannot expect any benefit
Hmm.
if it is a noble profession. But
True.
now it's no longer a noble profession, and in that, yes, doctor patient relationship is definitely is not that cordial. Hmm?
Hmm.
And a sort of mistrust is there in doctor also, in patient also, because of increasing number of litigations.
Hmm.
Litigations are increasing because patient is not trusting the doctor, and he is charged of negligence
Hmm.
because he deviates from his path.
Hmm.
See, there are four things uh, to be a honest doctor: that he doesn't deviate from his duty, he doesn't cause any damage to the patient, he is not found wanting, and of course, patient is not harmed or death doesn't occur because of his actions. So there are people, yes, doctors do their duty, but at the same time, there are some doctors who deviate from the path. Say, I'll give you just one example. Say there's a simple case of depression. Since I'm a psychiatrist, I'll talk of my own specialty. Patient of depression comes with very varied symptoms, including psychological as well as physical symptoms. Psychologically, he is very low mood, hopelessness, helplessness, crying spells, suicidal ideas. But at the same time, he may have physical symptoms like headache, generalized body pain, weakness. So what we do is that after we diagnose the patient, we give him a course of antidepressants, and within 2-3 months, the patient becomes all right. That is a simple way of treating the patient. There is another doctor to whom this patient goes. He sees that the patient is having headache. He will order him MRI, get MRI done. Since you have got headache for quite some time, refer to the neurologist. You have got gastric upset, refer to the gastroenterologist. Since you are feeling weakness and you have gained weight, let all hormonal assays be done.
Hmm. Hmm.
So all these investigations, he may defend them, that because the patient is coming with these symptoms, so that's why I'm investigating him fully. But at the same time, what is the justification when the is just speaking through his symptoms that he is suffering from depression? So this is a very tricky situation. There is a very thin line between ethics and non-ethics, unethical and non-ethical. So in such kind of situation, what doctors do, sometimes it becomes difficult to detect that yes, something unethical has happened, because they may have their own stand in justifying their clinical skills.
So you mean to say these are the gray areas where
Very gray areas.
very gray areas, and where there is gray area and there is no crystal clear black and white, marketing plays a very important role, because a doctor can do that and cannot do that. It depends upon the doctor's wish, because at the end of the day he can justify that gray area, because the patient might need this. Because as you said, suppose if there is a diagnosis of patient depression, but headache, he may have some problem in the brain also. So to rule
True,
out, to rule out,
true,
he is going for the MRI, but that may be in 1 in 1,000 patients
right.
possibility. So in these gray areas, a doctor usually play around for referral or commissions, and it's very difficult to find out who is playing what, or at least giving the clear cut saying that what is right and what is wrong.
True.
True.